Hi, my name is Elaine Newell and I'm a diabetes nurse specialist. In this video, I'm going to guide you through how to give insulin twice daily. Why do I need insulin with type 2 diabetes? When you have type 2 diabetes, your body is making insulin, but it may not be making enough, or this insulin is not working properly to manage your blood glucose levels. Your diabetes team may prescribe insulin as part of your diabetes treatment. The action of insulin is to help control your blood glucose levels. What is twice daily insulin? Twice daily insulin is a pre-mixed insulin that is usually given as one dose in the morning and another dose with the evening meal, at least 6 hours apart. It contains a mixture of rapid-acting insulin that deals with your meals and intermediate-acting insulin that works in the background. Some examples of pre-mixed insulins are Novamix 30, Humalog 25 and Humalog 50. The rapid-acting insulin starts to work immediately to deal with the food you are eating. The intermediate-acting insulin works in the background to help reduce the rise in high blood glucose levels between meals. How to get your insulin injection ready. We begin by washing our hands with warm soapy water to clean them. We check that we have the correct insulin pen, the correct strength and the expiry date. The insulin needs to be mixed before it is given. To do this, roll the pen 10 times between the palms of your hands and then rotate the pen 10 times. The insulin should be white and cloudy after mixing it. Peel off the paper, attach the needle to the pen and twist in a clockwise direction until it is tight and will not twist any further. Pull off the outer clear cap and keep it for later. Pull off the inner needle cap. Short needles of 4 mm and 5 mm are small and thin to reduce discomfort when you are injecting. You only need to inject just under the skin and not into muscle or vein. Use a new needle for each injection. Before you perform your insulin injection, you always need to do a 2-unit air shot. Press and hold until the dose button returns to 0. A drop of insulin should appear at the needle tip. If you don't see anything coming out of the needle, repeat the process again with another 2 units as an air shot. This removes any air bubbles from the needle and is called priming your pen. The pen is now ready to use and you select the insulin dose directed by your nurse or doctor. If you dial past your dose, just dial back down again on your dial window. How to give your insulin injection. Your injection site can be in your abdomen or your belly, your outer thigh and upper bottom. If you are very lean, you can inject in a semicircle under your belly button. Otherwise, you can use all the sites around your belly button. It is important to change your injection site every time you inject. Inject your insulin a finger width apart in a clockwise direction. This reduces the chances of developing lumps under the skin called lipos. These lumps can stop the insulin from working properly in your body and avoid ejecting into lipos. Take the insulin pen in the palm of your hand as shown. Insert the needle directly into your skin at a 90-degree angle. Press the dose button until the dose counter returns to 0. Press and hold the injection pen in the skin for 10 seconds after this to make sure you give your full dose. Take the needle straight out from the skin. Put the needle into the outer plastic cap and safely unscrew the needle and dispose of it in a sharps container. Your healthcare team can advise you how to get a new sharps container when this is full. Put your pen cap back on your pen to protect the insulin. A pen case is useful to keep your insulin in. How much insulin do I need to take? How much insulin you need to take is determined by your blood glucose levels. Check your blood glucose levels twice daily a fasting reading, that is before you eat or drink, and another reading before your evening meal. These readings will help you adjust your insulin dose to reach your blood glucose targets to manage your diabetes more effectively. Then give your twice daily insulin, one injection with your breakfast in the morning and the second dose with your evening meal. It is important to understand that your insulin dose may need to be increased over time. Your insulin dose may also need to be reduced at other times with physical activity or with weight loss. Useful tips. Store unopened insulin pens in the fridge between 2 degrees Celsius to 8 degrees Celsius away from the freezer. The insulin pen you are using can be stored at room temperature away from excess heat and cold for up to 4 weeks. It should be discarded after this. Make sure your blood glucose is above 5 millimoles per litre before driving and check your blood glucose levels every 2 hours thereafter. Inform your motor insurance company and the driving licence authority that you take insulin. When travelling, carry your insulin in your hand luggage with extra supplies and a letter from your nurse or doctor. Proper insulin injection technique helps with greater blood glucose control and supports good health living with diabetes. If you have any questions, please contact your doctor or nurse, and thank you for watching.